What does grief feel like in the body, and what is grief doing in the body? I'm going to talk about the physical symptoms of grief. I'm going to talk about kind of those initial short-term grief is happening right now in your life, and how does that feel? I'm going to talk about the long-term physical consequences of grief. And I'm also going to talk about it from an Eastern medicine perspective of like where these emotions are being held in the body. So let's first talk about what we might think is the obvious. The obvious is those physical symptoms. There has just been grief in your life. Think about what's going on for you. What is the grief in your life? And it might be complex or compounded grief. For me, I have lost 3 children and my husband, and each one of those deaths were a different type of grief, and the feeling and the physical manifestation was also different. But grief can also be a loss of a relationship. Betrayal grief sometimes feels more painful because it was a choice on the other person's side. So think about the grief in your own life and how it is physically manifesting. Some common things are shallow breathing, some chest discomfort. I won't say chest pain, because if you are experiencing true chest pain, that needs a medical assessment, right? Chest pain is a sign of cardiac or heart problems. But chest tightness, difficulty taking a deep breath, stomach problems, feeling nauseated or having constipation or diarrhea, or just, low appetite or increased appetite. Just the stomach, the gut often will manifest some of those feelings. You may be having trouble with sleep, maybe having trouble falling asleep because there's so many things going on in your mind. You may have trouble staying asleep. For me, after my daughter died in her sleep, and I woke up to her already being dead. And that morning was very traumatic for me because I tried to do CPR. I wasn't fully convinced that she was dead. I often wake up at 3 a.m. in the corner based on, what was going on with her body in the morning, did believe that she died around 3 a.m., right? But is that trauma or grief? And I'm going to talk about the difference. What is trauma? What is grief? And how you process these things differently. When you have traumatic grief, you are experiencing both things. And so the physical manifestations can be that chest tightness, the stomach problems, the sleep problems, general fatigue, aches and pains, your joints hurting. I have had all the workups in the world around aches and pains and fatigue. And I do have some abnormal lab work, because now we're going to switch to the long-term, what happens long-term in traumatic grief, or grief that is getting stuck in the body, is that there actually could be long-term symptoms. So when we think of physical symptoms of grief, we think about the things that I've just talked about, right? Everybody feels this shock of pain and discomfort and feels it in their body when they are experiencing acute grief. But oftentimes, if we don't process that grief, and it's really, really difficult to process traumatic grief. When I first started studying grief, after my second son died, I started really studying grief, and there was nothing around this abnormal traumatic grief, or very little. It was a lot towards normal grief. Somebody passes and then we feel sad and depressed. And I have a whole video on the Kubler-Ross 5 stages of grief, not actually being created for the survivor. It was created for someone on hospice, right? So when you have this kind of abnormal, out of order, traumatic grief, whatever you want to call it, even if it is of a parent, maybe it was way too soon, maybe that relationship was very close and tight, maybe there was significant attachment in those relationships. Those theories, go back and watch all of my videos on the theories of grief. But what happens with grief long term? We can actually have physical symptoms long term. We could have chronic fatigue and chronic pain that doesn't seem to be coming from anywhere. There's actually research that there is a 30% increase of heart attacks right after a traumatic grief and a significant grief in your life. That there is an actual physical manifestation that can happen. And so watching for those cardiac symptoms is also super important. Long term with that chronic grief, anytime you're under chronic stress, you are decreasing your immune system. And when we decrease our immune system, all kinds of things can happen, including what the medical community autoimmune, where your body is kind of attacking itself. Now, I'm not saying that all medical things are related to your grief. I'm saying I want to bring this to consciousness. I want you to realize that maybe working through your grief and understanding how to separate trauma and grief, that you can begin to feel better as well. And then the stomach and metabolic issues can be chronic. I mean, when the stomach is not working properly for a long period of time, everything gets dysregulated. The gut is the center for your neurotransmitter production. It is the center for your immune system. It is the center for your nutrition, right? And when that gut gets dysregulated, you can have chronic issues there. So we've talked about the acute and the chronic issues or physical symptoms of grief. And there's a well-known theory in psychology that there is a mind-body connection. And there's kind of some mixed research. And so unfortunately, you have like alternative and functional medicine providers, and then you have your doctor that you go to. And they might not be telling you the same thing. You need to listen to both, and you need to be responsible for your own journey. But there is definitely something to this mind-body connection, that what we hold on to mentally, emotionally, spiritual conflicts, these things do manifest in the body and can manifest as these physical symptoms. I have personally gone through a lot of physical symptoms. I was diagnosed with PTSD. I had some abnormal lab work. I still have fatigue and aches and pains. I am sleeping better, but there is still some manifestation of my grief and trauma in physical symptoms. I have gone and seen both my primary care doctor and alternative medicine doctors, right? When I thought that maybe there was some sort of cancer, I'm getting an MRI of my abdomen, MRI of my brain. I am making sure that there is not something medically, physically obvious that the medical community needs to address. But I'm also going to my alternative practitioners and kind of figuring out this mind-body connection. If I continue to work through this trauma and grief, if I take in the nutrients and avoid the toxins, can I get rid of some of these physical symptoms of grief? And the answer is yes. The bad news is it's not overnight. I want to dive into this a little bit. I am not an expert in alternative medicine. I am well versed in many aspects of it. I get frustrated and encouraged at the same time because it is not a hard science. You can get different opinions. It appears that people are trying to sell supplements. And so I am very cautious in this space. And your medical provider might be cautious of you pursuing in this space, right? So this is your journey, your responsibility. But I can tell you some of the things that I have learned that seem to be very obvious to me. So in Chinese medicine and in other Eastern cultures, it is very well known that the body is holding on to these emotions and in very specific areas. They talk about the lungs being where grief is stored. And I have been doing some breath work and trying to work through some of these things of having shallow breathing. Trauma is apparently stored in the diaphragm. The diaphragm sits right below the lungs. So if you have traumatic grief, you can imagine, and your heart hurts. I always think of it as my heart, right? And that goes into the chakras. If you've ever heard of, you have these 7 chakras, and one of them is this heart chakra, right? This giving and loving chakra. And it is in pain when you're in grief. And so I've lost 3 children and my husband. So I have this grief, feels like bricks on my chest. But then much of it is traumatic grief. I'm tightening up my diaphragm, and so I'm not taking those deep breaths, and maybe I'm protecting my heart chakra. And so I'm also, likely standing more like this. All these things in it, and it takes time. I could go through a breathwork session and meditation session and feel good, and then wake up the next morning and be starting all over again. So it is not an easy journey, but I want you to be aware that there are 2 systems going on in this physical manifestation of grief. And I want you to be aware of both of them and seek out knowledge in both of them. So my advice to you is, 1, follow up on any medical symptoms that you're having with your medical provider, your primary care, whatever specialist you're seeing. But also consider seeing someone who is into more holistic nutrition, vitamin supplements, and make sure that you are giving your body what it needs. Next, I want you to learn to separate grief and trauma. And this is what we really get down and dirty in the grief intensive. If you want information about that grief intensive, I want you to click below. Even if you just want to start following me, you want to get the emails, you want to be encouraged that you can work through grief and trauma, give us your email address. I am giving away lots of free content, but also the grief intensive is where you can come and really learn to separate that grief and trauma. So think about grief. You have lost something you dearly love. And I'm just going to assume that if you've made it this far, it was somebody really, really close to you, probably a child or your husband or your sibling. And you want to be healthy, you want to process that grief, but there is no way you are going to release. And so the pain of grief has to be felt and cherished. It is okay to cherish the pain of grief. It is not okay to cherish the pain of trauma. We all know in the field of psychiatry and psychology that trauma needs to be processed and released. We have various professional techniques. There's books on somatic release. There's all kinds of techniques and things that we talk about of releasing trauma. But when you have traumatic grief, and losing a child is traumatic grief, those 2 things are enmeshed. That grief and that trauma is enmeshed. And somebody's trying to, even if you're going to a counselor and you're trying to release that trauma, but you're like, no, this is my grief, my pain. And you have every right to hold on to that pain of grief. But I want you to learn to do is separate those so that you can work through that trauma and release. Feel the pain of the grief and hold on. Cherish that relationship forever. I don't want you to have it stay enmeshed and hold on to the grief and the trauma. I hope that makes sense. Continue to follow me. I want you to go into my series on grief theories. I went through, when I was going through my 45 days of grief, I studied multiple grief theories. Some resonated well, some did not. But again, come to the grief intensive so that you can really learn to separate the grief and the trauma. We can do this.